Hello student, Assalamu alaikum. In this video, students, we are going to learn about the few important ligaments and important intra-articular structures related to knee joint, particularly on this model. Here, this is the model of the knee joint where you can see this is femur, shaft of the lower end of the shaft of the femur, and these are condyles of the femur. Medial condyle, lateral condyle of the femur. Then we have got tibia, which is articulating with the femur, and these are called condyles of the tibia. And the tibial condyles are flat means they are flat from above. It means these are called tibial plateau. So here you can see, whereas this small bone, this is called fibula, and this is head of the fibula. Then we have got neck of the fibula and shaft of the fibula. So in this particular model, you can see this is tendon of the quadricep muscles. Quadricep, quad means four, sept means heads. So this muscle has got basically four heads, which are vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris. So all of these four muscles, they come together and form a single tendon, which is called quadricep tendon. Then this quadricep tendon, it wraps the patella bone, which is also called kneecap. Here you can see patella bone. This is patella bone, which is also called kneecap, and it articulates with the patellar surface of the femur. Then inferiorly further, this there is a ligament which is called patellar ligament, or it is also called ligamentum patelli, and this ligament, it gets attached to the tibial tuberosity of the tibia. So patella is, this bone patella is sesamoid bone. It is the example of largest sesamoid bone in the body. So sesamoid means seed-like or sesame seed-like. So it is acting as a fulcrum. This bone is acting as a fulcrum and gives mechanical strength to the tendon of the quadricep muscle to extend the tibia at the knee joint. Then we can see there are two blue structures. These two blue or C-shaped structures are basically a fibrocartilage. It is a fibrocartilage, and this fibrocartilage is C-shaped, as you can see here. It is C-shaped fibrocartilage, and these are menisci. They are thick at the periphery. Periphery, but thin at the central portion. So in cross section they are wedge shaped. So here they are thick at the periphery, but on the inner aspect, these menisci are thin. Or so in transverse section, in axial coronal section, they are basically triangular or wedge shaped. So we have got two menisci. These are fibrocartilage. This is medial meniscus, and here we have got lateral meniscus. Then these are basically help in the shock absorbing, acting as a shock absorber. So here you can see this is posterior cruciate ligament. Likewise, here anteriorly we have got anterior cruciate ligament. Here you can see this is anterior cruciate ligament. So these two, they are attached onto the intercondylar area of the tibia, and this anterior cruciate ligament, it moves posteriorly and laterally, and it gets attached into the medial surface of the lateral condyle, and this is posterior cruciate. This posterior cruciate attaches itself on the tibia in the intercondylar eminence more posteriorly, and this ligament, it moves forward and anteriorly and gets attached into the medial surface of the lateral surface of the medial condyle. Then here we can see this is meniscofemoral ligament. It is also a part of cruciate ligament. So anterior cruciate ligament here, this is anterior cruciate ligament here, and here we have got posterior cruciate ligament. And these two ligaments are cruciate because they cross each other in a crisscross manner. One is going from posterior to anterior and other one is coming back from anterior to posterior. So that's why these two ligaments are called cruciate ligaments. Then we have got here, this is medial aspect of the joint. This is called tibial collateral ligament or medial collateral ligament, whereas this ligament, smaller one, is called fibular because inferiorly it is attached to the fibula and superiorly it is attached to the femur. So this is fibular ligament or lateral collateral ligament, and here we have got medial collateral ligament. So medial collateral ligament, its deep fibers are basically attached to the medial meniscus. Here they are attached to the medial meniscus. So whenever medial collateral ligament it gets damaged, there are chances that it will definitely involve this injury will involve the medial meniscus as well. So medial collateral ligament, medial meniscus, and sometimes if anterior cruciate ligament is also involved in such type of injuries, this type of injury is called unhappy triad. Triad means three. So three structures are involved in such type of injuries: medial collateral, medial meniscus, and anterior cruciate, here anterior cruciate ligament. Whereas here you can see this is articular margin. Below this surface smooth one is covered with hyaline cartilage. So this is articular surface, whereas just above this margin we have got non-articular surface. So again, femur, lateral condyle of femur, medial condyle of femur, lateral condyle of tibia, medial condyle of tibia, tibial tuberosity, head of the fibula, neck of the fibula, quadriceps tendon, patella bone. Then we have got ligamentum patelli. Patella bone is largest sesamoid bone in the body. Then lateral meniscus, medial meniscus. Then we have got posterior cruciate, and here we have got meniscofemoral ligament. Then we have got anterior cruciate here, then tibial collateral or medial collateral, and this is fibular collateral or lateral collateral ligament. So this was brief about the important ligaments and structures related to knee joint with OSPE point of view. I hope this explanation will help you in preparing for your spotting or OSPE examination. Thank you very much.